recall, thank you. This is Dr. Leslye Kemp. When we started these conversations, oh, I don't know how many, when did you start working on your doctorate, Leslye?
Was that 2021?
I think close to it, but you all may remember Leslye was one of the nurse practitioners that was willing to come on and support and be a part of our medical experts. And I want you all to raise your hands and applaud because now we have Dr. Leslye Kemp.
Oh,
And
thank
as soon as she finished, you all, she reached back out and said, how can I come back and join and support the team? And as you may recall, she was a part of what we appreciated, someone who understood women's health and adult health. And when I asked for someone to help me curate or figure out what we could do with this, because this was a very unusual topic, Leslye went into her favorite mode, which is research and representation of that which is hard to describe. And she's willing to do that. And she said, I'm more than happy to help you with this one today. So I am happy to share with you that Leslye received her doctorate of nursing practice and master of public health from both of them from Johns Hopkins University, and she has a Master of Science from Vanderbilt. And we are just happy that she loves public health, she loves health policy, and she really is interested in how our systems and structures shape what we are and what it does not shape what we are. And the important thing of how do we get those things right together. So tonight we are ecstatic that she's going to try to help us understand more about our hearing. And like it said, we want to tonight break the silence. Addressing our hearing loss together is what we're doing. So welcome everybody. We are truly happy to have you, Leslye, and turn your hearing aids up. And everybody, let's have open minds. And as we do, let's please, let's just ask as many questions as we go along so we can give Leslye, the love that we want. And or put your questions in the chat and I'll make sure to capture them. All right. Thank you, Leslye.
But thank you so much, Lisa, and thank you guys for having me. I want to mention I am overdue for my eye exam and in desperate need of a new prescription. So you'll see me. I've got notes. I've got two screens because I just knew I wouldn't be able to read the notes here. So I just wanted to say if you see me kind of looking, it's because I need a new prescription and I've got to lean in a bit. But I'm super happy to be here. When Lisa came to me about talking about your heart and your hearing, she's right. These aren't topics that you don't really hear the two topics together a lot, but they are connected. And that means a lot for you and for what you can do about your health. So I'll go ahead and jump in. But like Lisa said, if you have a question, feel free to ask while I'm talking. Feel free to put it in the chat. If you want to save it to the end, that's fine, but just feel free to jump in informally. And let me move through here. Hang on a second. Now, at least I'm trying to get my slide to move.
Okay.
Here we
Well,
go.
you
Got
got
it.
it? Okay.
Got it.
All right.
My little buttons weren't working. So, how many of you know somebody who has both high blood pressure and hearing loss?
Mm.
Yeah. So a number of us may know somebody with both of those things. Um, and again, you probably think, oh, those don't really go together. Blood pressure and hearing, what do they have to do with each other? They're separate problems, but they're really not. They're really quite related. So nearly two-thirds of people with heart risk factors also have hearing loss. So that's 64%, and that's not a coincidence. And then it runs the other way too. So if you already have hearing loss, your risk of developing heart disease goes up by 20%. And heart disease is still the number one killer in America. So everything we talk about tonight is going to be around that cardiovascular disease as well. And so the numbers aren't meant to scare you, but just to connect some dots that your health provider may not have ever even connected for you. So we'll move. Let's see. So your ear really depends on your heart. So you can kind of think about the inner ear. It's like a garden, and it gets water from one pipe. And I'm going to show you a picture of what that looks like in just a minute. But if anything slows or gets blocked in that pipe, the whole garden, if we think about it that way, suffers. And that pipe is the vascular system. So I just wanted to put here a few of the main terms: the cochlea, the inner ear. It doesn't have a backup blood supply. It relies entirely on that vasculature. And then when that blood flow is reduced, then the delicate cells in your ear start to die. And that's why the same things that can harm your heart also can harm your hearing. So, kind of main point, it's all the one same blood supply, and there's no backup system. And that damage is what's related to the vasculature system and hearing loss. And so if we look here, I tried to get this picture where you could see it well, but they do a great job in the inset. They kind of blow up this area that we're talking about, but you can see this artery here. And so everything really does come from one system. So when your provider, your doctor, your nurse practitioner is helping you manage your blood pressure with medications, they're also in certain ways helping you manage your hearing too. So when you're keeping that system healthy, you're keeping that garden of your inner ear healthy as well. So let's talk.
Leslye, before you go further, are you able to go back to that slide and point out for the group? Can you point out the inner ear, what you're calling the garden? I know we see the vestibule, we're not supposed to put Q-tips in there, but
Right.
if you were to use the pointer to say where it's going, would you mind talking about that inner ear and that, when you said artery,
Mhm.
what you were really talking about?
Yeah, and so this one,
Excuse me, Leslye and Lisa. I am not seeing the video that she's showing. I'm not sure if I'm the only one, but I'm not seeing it.
If others can see the slide, let me know.
I can see it.
Okay.
I can see it too.
Okay. Um, come out, go out, Belinda, and come back in, please. Okay. I'll let her back in. You go right ahead, Leslye.
okay, sounds good. So I'm talking about, let's see if my pointer is working. It's kind of disappearing. So I'm talking about this area here, and in this picture, I'll say you don't get a full picture. This one is really focusing on the vasculature, so you can't in this one necessarily see everything else that's in there. But what I can do, you can do a quick Google search for imaging the inner ear to see all the different little intricate systems. But you can think about it, just everything in there that has to do with your hearing. So your eardrum, things like that. They're not, that would be kind of here, pictured here, but all of the little minutia in the inner ear in this part that has to do with your hearing. And so this is the main artery here. And so it branches off. So that's when I say there's really only one blood supply. You don't have all these different arteries running to that area. You just have that one main artery.
I forgot I
Okay.
had a baby girl.
Okay. And did I hear a question? Was there another question?
No, I think she was saying she could see it now
She
with
can
the.
see it. Oh, perfect. Okay, good. I just want to make sure. Um, and so if we think about just the big four factors that can hurt your heart, hurt your hearing, diabetes. So we know diabetes, you get high blood sugar, and then with that high blood sugar, you can get damaged blood vessels. And that includes the tiny ones in the ear, branching off of that artery. People with diabetes have 43% higher odds of hearing loss. And we know, again, diabetes damages small blood vessels throughout the body. That's why you can think about diabetic neuropathy, for example, where you start to get numbness, maybe tingling in feet and extremities. And so those are smaller blood vessels as well. It's just less well known that the inner ear is also full of these little small blood vessels branching off. And so you get that higher amount of risk, that 43% with diabetes. And then in terms of high blood pressure, something really important, nearly half of all Black American adults have diagnosed high blood pressure. And that's one of the highest rates of any group in the world. And high blood pressure damages this vasculature as well. It damages specifically a structure in the ear. It's called the stria vasculature, but that's responsible for maintaining the fluid balance in your ear that makes hearing possible because we have fluid in our ear as well. In the research that's out there, interestingly, that association is stronger in men than in women, the high blood pressure association. And the thinking is just because women have a protective effect from estrogen, from that hormone throughout part of their lives. And so that's just an interesting fact about the association. Smoking is another really big risk factor. And I think that one surprises people sometimes thinking about smoking and hearing loss, but it's the single strongest independent predictor of hearing loss. Smoking is not blood pressure, not diabetes. It actually doubles the risk of hearing loss. And then the good news is former smokers in the research did not have significantly higher odds. So if you quit, if you become a former smoker, your odds can decrease with that. Quitting appears to reverse that risk. And then we look at poor heart health overall. And so that's kind of this cumulative finding, having two or more heart risk factors. So if you have two or more risk factors together, then your odds of hearing loss nearly double compared to somebody with none. And it's just that kind of idea that the body's keeping the score and these things can mount up and accumulate over time. Were there any questions on any of those?
I have a bunch of questions, and you'll forgive me because I don't know if you want to speak at it towards the end or if you
Yeah,
want the
go.
questions now, just because there's a lot you're saying that I got a billion and one. Uh,
Lisa, do you have an opinion? I don't have
No,
a preference.
no, you can ask as you want to,
Yeah.
go for it.
my father has in 2017 he had a quadruple bypass,
Mm-hmm.
and he also has diabetes,
Mm-hmm.
and he also has high blood pressure.
Mm-hmm.
And we've just realized that it's really, really difficult for him to hear. But when
Mm-hmm.
he goes to the doctor, they keep telling him that his hearing is fine.
Mm.
Has he been checked by an audiologist?
Probably not, because essentially that's one of the things I'm learning is that your primary care physician smiles and nods at you,
Mm-hmm.
and they don't necessarily, when you're like, Dad, he looks fine, but he has multiple issues with health. So trying to actually have them cross coordinated is already always difficult. So I'd love your suggestion on what to do because
Yeah.
he can't hear. He's got the TV up to whatever. You'll
Sure.
stand next to him. He cannot hear well.
Yes, and there are, there's some hearing things you can do in primary care, but not a full test like an audiologist can do, where they're testing across different tones and is it high frequency or low frequency. And so towards the end, I've got some resources.
Okay.
So some of those might be helpful, but what I'd say is, I'd say explicitly to that provider, depending on if he requires a referral. Some insurance, he may not even require a referral, but I'd say, can I have a referral to an audiologist? And what area do you live in?
My father and mother live in New Jersey. I live in Maryland. So
Okay.
it's and they're both on Medicare.
I was going to say, yeah, depending on where they are in New Jersey, a lot of times, like I'm in Nashville, Tennessee, there's a huge audiology clinic at Vanderbilt, for example. So if there are universities nearby, a lot of times they'll have, especially if it's a medical university. And then there's private audiology practices. But I would ask, hey, I need to be referred to an audiologist.
All
And
right.
you can do that nicely, but say it in a way of like, hey, I just want it documented. I'd like to be referred. Can you put that in and ask for that documentation? And I'd have to check with Medicare, depending on which one. He may be able to just call and get an appointment and not even have to go through a provider. But I would
Yeah.
say with that background and the fact that you guys are all saying he can't hear, yes, he needs to be screened.
Okay, perfect. Thank you so much.
Yeah,
Great
you're
information.
all right. Ooh, losing my papers here. So as we kind of move in, we can look a little bit of research, and there were actually a couple of big studies that just came out on this topic, and I think it matters. So when we're talking about our own health, this 92% comes from this clinical study of over 6,000 patients, and that was at a major academic medical center. The 20% comes from a study reported by the American Heart Association in 2024. And then the 4,441 is from a 2026 study published in BMC Geriatrics, and that was using National Health Survey data. And I'm bringing up all that and just kind of telling you that because one is like this big 6,000 person study, one is just national data compiled, and then another one with American Heart Association. You get a lot of different overlapping communities when you have that amount of data. So I just think that's important in terms of the research teams. And so what we see here is that 92% higher odds of hearing loss, again, if you have two or more heart risk factors, ups your odds by 92%. That 20% greater chance of developing heart disease if you have hearing loss. And then the 441 patients studied, hang on one second, sorry. Oh no, did I just lose my PowerPoint?
No, we still see it.
I lost it on my side, hang on. Hang on one second. Now, let me close this out. Gosh, I don't know what I did.
Mm. Oh, can you see the screen at all?
Hang on, let me do this.
Your
All
mouse is
right,
moving too, so we could see your mouse moving
I've got
across.
it back now.
Yeah.
Okay,
Okay.
thank you. I don't know what I did. Um, so yes, and we had those patients studied across all three major heart conditions linked to hearing loss. So again, just more evidence that your heart taxes your ears is one way to kind of think about it, but your heart has an effect on your ears.
Was there anything that said it says two, or if it says three major, what are those two or those three major heart risk factors? I mean, are we still saying high blood pressure? Are we saying um con too far if you're congestive heart failure, but what would be those
Yes,
major risk for the heart specifically?
so it's going to be
Diabetes, yeah, yeah.
yes. So it's going to be hypertension, um, high blood pressure, history of stroke, a history
Okay.
of any kind of cardiac events. Any of those things are going to be risk factors. And hang on, let's see if this was my study right here. I had it pulled out
Okay.
just to make sure that I'm not missing anything. High cholesterol is sometimes listed, although it's a little bit conflicting. So some studies don't necessarily see that as an independent risk factor, but any kind of heart, if you want to think about it, any sort of issue that's going to affect your heart, so blood pressure, stroke can have to do with heart. Anything that's affecting the circulation of your blood through your body, any heart damage, heart failure, like you said, congestive heart failure, any of those can affect your hearing. Okay, so I'm clearly, hang on, something's going on with my computer, but I'm moving along. There we go. And so I wanted to talk a little bit too, because I am interested in health disparities and health systems and thinking about that broadly as well. We know that chronic stressors from a number of different things, from racism, from poverty. We talk a lot in public health even about the built environment, like where you live. Are you rural? Are you urban? Is your environment built in a way that it's protective for you, or does it hurt you? Are you able to get out in green spaces and walk and feel safe and things like that? So we know that all that kind of chronic stress can wear down the body and accelerate aging. And it's just an important thing to think about when we think about health, healthy populations and healthy communities, and recognizing these issues that we might see around us. And we know that Black adults show a higher biological aging markers, um, almost a decade older. We know that by age 45, 50% of Black women had higher allostatic load scores. And that just is the fancy way of saying just their physiological, their chronic stress. Um, and socioeconomic status doesn't explain it. So it doesn't matter, if you're wealthy, if you're not wealthy. And that is thought to be directly related to certain stressors like racism. So it's not just connected to income. All right.
Before you go on, I just want to point out, and you said it very nicely, the new way of, I think, talking about this. And at the same conference I was at this weekend, they talked about stress and they talked about weathering. And that's what Leslye is talking about, that weathering where our alleles, our genes are affected. And so because of the stress, because of our race, the racism, those areas, that's a whole nother topic or talk that we could have. And for those of you who are from Spelman, Jane Middlebrooks Morgan talks about Dr. Morgan, who was here and did the COVID and vaccines talk for us. She has a whole talk that she does about women and weathering. So if that's something people might be interested in, we can definitely share from that perspective too. But that's what that's all about.
And Miss Lisa,
Yes.
also, I just wanted to ask, I did join late, and pardon me for that. Did we state that there is a lovely book called The Body Keeps Score? It's an excellent read.
No,
It's
we
an
did
excellent
not.
read. Yeah, it's an excellent read, and it talks about just the different approaches of stroke, of illness, of how you're being raised in the house, and how your body stores, like it's kind of a chemical reaction to stress, pain. Kind of you walk into a store and you smell something and it reminds you of when you're a child. Your
Oh,
body
wow.
keeps score the same exact way. Excellent book if anyone is a reader.
So
Great
would you
book.
put that in the chat for us?
Yes.
And I'll write it down as well. That's a good resource.
Yeah, that's a great book. It's been a while since I read it, but I have that one on my shelf. And this kind of research, I do think it's so interesting. There was a lot around, for example, that kind of epigenetic factors, what things do to our genes, and there's been a lot around Holocaust survivors and then their families. And how that may have impacted genes. And I'm glad that we're doing more and more research in that direction. Okay. So I also wanted to mention, there's a domino effect. Hearing loss doesn't travel alone. So you can have untreated hearing loss. That can lead to social isolation, right? Because when you can't hear everybody around you, you can't interact with conversations. And I don't know about you. I know my mom, for example, has some hearing loss, and she really doesn't want to admit that. I think sometimes there are issues around that. We just don't want to admit something like that. But what I see a lot of times is that this social isolation. She's kind of left out of conversations because she can't hear. Depression and anxiety can come from that, less physical activity, and again, that higher heart disease risk. So this is where all of these factors can influence. We know that depression has an impact on your heart. We know less physical activity has an impact on your heart. Another big one, this is one close to my heart because my father had Alzheimer's dementia, but hearing loss is the number one modifiable risk factor for dementia. And this has been observed and stated many, many times. So it's related to that brain health as well. Hearing loss also increases the risk of falls, depression, and loss of independence.
Leslye, before you move on, I'm not sure that everybody understands what you mean by a modifiable risk factor. Do you mean if I get hearing aids, I can lessen my chances of the dementia? What does that look like? How do you fix that?
So, yes, when they're saying a modifiable risk factor, what they mean is that yes, exactly that. You get hearing loss, the thought, or you get hearing aids. The thought is that that's something you can modify, and that may reduce your dementia risk. Some of the thought behind that is if you're already sort of predisposed towards dementia, maybe just with other lifestyle factors, if there might be some genetic risk like APOE4 genes or something like that. But when you have hearing loss, then that is accelerated. It's accelerating your chances of dementia, and it's because your brain is not getting the stimulation that it would get through hearing and being in these conversations. So again, all these other factors like social isolation, depression, anxiety, all of that can be kind of coupled into this dementia acceleration. So yeah, modifiable is just something you can change.
Okay, thank you.
Excuse me. And then when we're thinking about hypertension as well, just to mention, hypertension isn't something that we only get when we're older. You see hypertension across age ranges. I've seen patients in their 20s developing hypertension. And we know again for Black Americans that cardiovascular disease tends to begin earlier and hit harder. And there might be a lot of reasons for that, including treatment, access to treatment, or not being treated appropriately. But there are lots of reasons around that. And something I just want to mention, because that high blood pressure, as we know now, is so closely related to hearing loss and developing that later on. Heart failure risk is also higher for Black adults than for white adults in America.
Can I share something as an
Sure.
example? Because you said it's not an old person's disease. I
Mhm.
received a text last night, everyone, that stated that a young man, Michael, was in the ICU and at the hospital out of Virginia. And he's a friend's son. He got sick. They took him to urgent care. Urgent care took him immediately to the hospital by ambulance. This is a young man in his 20s. The blood pressure that he had was a stroke level of 270 over 150. They were running tests. He's actually, his 29-year-old kidneys were trying to fail. He had to be seen by a nephrologist. He was actually put on dialysis for the short term to basically save his kidneys and to try to help bring down his blood pressure. So when they recognized what was going on, Michael told them that he had hypertension, but had not told any of his family members, so nobody was aware, and that he was not checking his blood pressure regularly. And then they were reminded by the physicians that this is not about your age. All of us should be checking our blood pressure regularly. So, and she said, and this is something to be discussed on the health forum that we lead. So thank you for bringing up that point to do. So but
Wow.
he's better. He's much better over the last day. He's turning the corner, but
Good.
it's a long road for him.
Wow. Wow.
Mhm.
Thank- that's amazing that they, said share the story as well. And I'm so glad he's doing better. And for the sake of time, because again, I'm so interested personally in policy, and as Lisa was saying earlier, how everything built around us shapes how healthy we are, or lack of health or access to health. And so I did include this when I was doing a lot of research around this as well. But just when we think about how neighborhoods were built, redlining, and there's a whole area of research I'm happy to send out afterwards. Lisa, I can email it to you if anybody wants it, but some different areas of research around this and how it's shaped health outcomes and continues to shape health outcomes for various communities.
Is with the show of hands, does everybody understand or know what redlining is? And I appreciate that you're going to send the information. Just by show of hands, would you like for Leslye to explain redlining?
Yeah, happy to.
Okay.
So kind of in a nutshell, it was federal policy, and so not a neighborhood choice, but a federal policy that essentially denied things like home loans to Black families in designated areas, and we can think about even like voting and gerrymandering and things like that. Right now, it's kind of the similar situation. So the maps were drawn 1930s. Maybe into the 1940s. And researchers, what they've done is they've overlaid those maps and kind of looked at modern cardiovascular disease data and the correlations, and then neighborhoods that were redlined, as they called it, have measurably higher rates of cardiovascular disease, high blood pressure, diabetes, and they have less access to screening. So you're thinking about where the neighborhoods are put, what they, built around the neighborhoods. So that reduction in access, and it's all built off this essentially 1930s federal policies that built neighborhoods.
Thanks, Leslye. Belinda, I saw your hand go up. Was that to have her explain, or did you also have a question?
No, that was just for the explanation.
Okay. All right. Perfect. Thank you.
And I always like to include it. And I think one reason I like to talk about how these things shape our health is, I believe that as individuals, there are absolutely a lot of things we can do for our own health. And that's powerful. And so having conversations like tonight about, well, what can you do about your hearing and getting screening that we're going to talk about is so important. But I also think it's important to know that there's a lot around us that has shaped our health. And, there's a lot of times there can be blame placed on individuals. And I just personally always dislike that because it's so much more than individual choice a lot of times. And, I believe I want to do everything I can for my health, and I'm sure that you do as well. But I think it's just important to know kind of the whole system and what's built around us. Now, there's one thing that's really neat. Research shows Black Americans historically have lower rates of audiometric hearing loss, and that honestly gets into an audiology term that I'm not an audiologist, and so I can't explain that as well. But just the types of hearing loss, the way the mechanics of hearing loss is really what it means. But it's because of, we talked about the cochlea earlier, but the melanin, basically, the pigment. And so the inner ear pigmentation, for whatever reason, offers protection from noise and age-related damage. So that's just an interesting tidbit that I found. But that protection doesn't cancel out poorly controlled heart disease or diabetes or hypertension. And since we do know that there's higher hypertension risk, and that's a big driver of these pathways, it's really important to, think about your heart health, your blood pressure health, and treating that if you've had a diagnosis. Another interesting thing here, just untreated hearing loss costs workers an average of $12,000 a year in reduced earnings. And so, that could be from many different mechanisms, but just maybe, you're not hearing somebody at work, and then maybe you're not getting promoted through, or maybe you're losing time, but that's just a statistic that they have found. So what can you do?
Question in the chat, I think. Did I see a question? What are the thoughts about AI hearing aids? Do you know anything about AI hearing aids, Leslye, or is that something we need to ask an audiologist or something else? Because I don't know anything about that.
I don't know anything about AI hearing aids. Like, Um,
I'm not,
okay. Yeah. Does
are we
anybody else have
understanding the question right, Dawn?
While we're waiting, I have a question.
Sure.
Okay.
I think earlier you mentioned something about high frequency and low frequency at different levels of hearing loss.
Mm-hmm.
The,
Yes.
okay.
And I'm sorry, you may have cut out a little bit. One of the things that so I'm gonna make sure I'm kind of answering the question. So when they're testing, you'll get kind of this whole piece of paper that's got sort of a diagram of your hearing and the tones that you can hear. So there's tones and then there's across different frequencies. And so I believe I'm going to go back to my clinical mind. I think high frequency hearing loss is the most common as we age. And so hearing higher voices a lot of times, there are things with frequency that also have to do with if you have you gotten I'm starting to get to this point where if I'm in a restaurant that's really crowded, I have a hard time hearing the people at the table. So filtering out all of those different voices around me. So there's different measurements for that as well. But the high frequency would be like losing the ability to hear a high pitched voice as well. And if you losing the low frequency, it would just be the low tones, like maybe a deep male voice or frequencies even lower than that. So they
Yeah, I
measure.
think that's what I have some problem with particularly on TV. It's just people are talking really soft. Is that the low
Yes.
frequency?
Yeah, and so if you were to get that audiologist report, the great thing about it is they can kind of sit down with you and tell you, oh, these are the specific areas, or these are the specific things that you may be missing, and that can just help you to know. So yeah, some people might have a harder time like with a male voice, versus maybe there's a female voice that's more high pitched. They might have a harder time with that.
Mhm.
So really.
Dawn did clarify, we were correct. There are new hearing aids out there, obviously, that are doing AI. And I looked up something and it says that it's not the same. It alters, it works with your ear somehow. But I would say let's talk to an audiologist or somebody who actually does those things. I don't think we know tonight, Dawn, sorry, about much about those things, but I'm glad that you brought it up so that those of us who may be interested in hearing aids know that there are other options.
Yeah, absolutely. That audiology and then, and an ear, nose, and throat specialist who
Yeah.
specializes in ear. Yeah, that's really interesting. So that's beyond my scope with AI. Um, but I think
Okay.
the important thing to know, catching this early is important, and you can't treat it if you don't know that you have it. So what you can do, I put up a free app here. It's called Hear Who. You can just put it on your phone. It's made by the World Health Organization. It takes about, I want to say like 5 minutes and just does a very basic screening. But you can test and do a basic screening with that app. And especially if anything comes up with that, you can go see an audiologist and get this full screening. You can ask your doctor. And so the question earlier, you can say, hey, I've got high blood pressure, or I've got high blood pressure and, this history and this history. And I know that that's linked to hearing loss. So can you refer me to an audiologist? Now, it might be interesting. There might be a doctor out there who doesn't themselves know that it's linked to hearing loss, but you can use that script. And then there are over-the-counter hearing aids. So that was newer to me. I knew that they existed, but apparently since 2022, you can get those without a prescription. I personally don't know how great they are, how well they work. I'm assuming if you purchased from like a Walmart or a Best Buy that you could bring it back for a refund if it didn't work, but those are options out there. And certainly something you could ask your primary care may have some information and know how well they work for some other patients who may have used them. And then just a few things for this month that you can do. Taking action, know your numbers, know what your blood pressure is, know your blood sugar, your cholesterol. Ask for those at your next appointment if you don't have them. Some of you may already have, a little blood pressure monitor at home. You can get a little wrist monitor and across a range of expenses. There are some that, 20 bucks, I think, are some of the cheapest ones. Asking about your hearing. Again, my heart health, my hearing may be connected. Trying that WHO app, do a basic screening if you want. Big one if you smoke. Make plans to quit. Try to work with somebody, just knowing that that can improve your health so much. And then share what you learned today, that your high blood pressure, your heart, all of that is connected to your hearing. And so I will stop sharing. I was trying to think if I had, oh, yes, I've got this. So the Hear Who app, and if you want to take a screenshot of any of these, but these are some other resources that I wanted to put up.
Leslye,
Mhm.
would you say that the person who is a heavy drinker falls in the category as a smoker because they both contracts the blood flow, right?
The drinker, so interestingly, smoking is vasoconstrictor, so it constricts the blood flow. Drinking, if you're a heavy drinker, yes. So we know like a little bit, and now there's back and forth too. Some say even no moderation. But originally, when you'd hear like a little bit of wine is good for the heart, and some of that was kind of opening the blood flow with just a little bit. I would say the biggest thing with heavy drinking is very correlated to developing cardiomyopathy, which is where the heart muscle weakens. So it gets bigger and it gets weaker and it doesn't contract as well. And also congestive heart failure from that. So that's going to be your biggest risk factor with drinking is you're doing something that's when you're drinking heavily, that's not protective of your heart. You're weakening your heart. So I don't think the data specifically is out there that it's as big of an effect as smoking, but it certainly would affect.
Good to know. So is this Claiborne Watkins or Carol Watkins that put OTC hearing aids are the same that were provided with the prescription at a higher price? The prices were reduced under a bill signed into law by President Biden in 2022.
Excellent. There you go.
I mean, it's almost like bifocals. I mean, when you go to, you still need to try to reading glasses. I wouldn't be as comfortable with hearing it over the counter hearing aids. How do you know what to get? Are they all the same one or whatever? But anyway, I'm not going to go down that rabbit hole with that one.
Can I just clarify, Sister Lisa?
Yes,
Just the
yes.
hearing aid piece, you would still have to visit an audiologist for
Oh,
them to tell you which type of hearing aid you would need to get, but then you can buy those any place. Previously, you could only buy hearing aids from certain providers like Miracle Ear or something like that. But now you can still get your assessment and you could purchase the type of hearing aid that you need anywhere, Walmart or Costco, Sam's Club, places like that.
Excellent. So it is like glasses. So I can go and get my prescription, but then I can go to wherever, Warby Parker or Walmart, wherever, and get my.
Yes, ma'am. Yes,
Got it.
ma'am.
Perfect. That
oh, nice.
good to know.
Okay. All right. Good to know how it's done. So thank you for that. So Leslye, I thank you for this. You accomplished what I was hoping to help our group understand our heart health and what it does, how it relates to our hearing, because we are so focused on making sure that we walk, talk, exercise, eat well, and do those things so that we know that this can attribute and help with our hearing. This is perfect. So we'll have the recording. It will go out. Are there other, and thank you so much, Leslye, for doing this for us. Any other questions before we go into, and don't leave us, I want you to see the celebration around our Walking for Talking as well.
Yeah.
I have just one comment to make.
Yes.
73 years old, and I never
Oh, hey, Pastor Flowers, how are you tonight?
never heard that you have hearing loss from high blood pressure. So that's good information for me to share with other men who deal with high blood pressure and who refuse to take their high blood pressure medicine and stuff like that. So I just want to say thank you for that insightful information.
Well, thank you. And I know Lisa had the idea, said this is what I want to talk about. And then I thought, wow, that is a great topic. So that came from Lisa's brilliant mind. But glad you guys, that you enjoyed it.
And what we didn't get to is that there are a lot of medications out there that also cause hearing loss that we take. That's a whole nother topic, a whole nother opportunity that we can look at, diuretics, chemo, cancer drugs. I mean, you name it, NSAIDs, just all kinds of things, but you need a whole topic to talk about that, time to do that, because that's completely different. And it takes a lot of care to talk about that too, because some of those medications are necessary and nice, but you need to monitor and to do that. Before we move into talking about the Walking for Talking, here's the last thing I'm going to ask us to do. When someone tells you that they think you might need to get your ears checked, I want you to we're going to be the first ones to raise our hands and go do it. Okay. We're not going to be afraid. This group is breaking the silence. We are willing we are willing. Don't be the ones that say, that's not me. I can hear you just fine. And most importantly is what she shared about isolation. Because when you can't hear, you self-isolate without knowing that that's what you're doing. And we don't want that to increase our risk. Pastor Flowers was like, okay, I'm giggling on this one. But that's great. So, Vakisha, are you on?
Lisa, can I ask a quick question? Because
Sure.
I didn't turn my numbers in for a walk and talk. I missed that whole process. So should I email them? I mean, should I?
Do you know them now? Send them to her. You go right ahead.
She could tell me how many she got because she was on the
75.74.
75.74. Let me see. And this is Miss Friday.
Friday.
Oh, so that means so Miss Lisa, that means that she got you on 120. I was waiting for the 120 because Miss Friday I didn't get any numbers, and I was like, we don't have a 120 winner.
I couldn't make it.
That is quite all right. That is quite all right. I'm happy to hear such a thing. So, bear with me just one good moment while I do my math. Sister Lisa, go ahead on and introduce the thing.
Lisa?
Yeah.
I went to my doctor and I had wax built up in my ear. And she recommended me to have my ears cleaned out. And after they had my ears cleaned out, I could hear just as well as you can see. I don't know. No.
That's not what the missus is saying.
No. The television is loud. He's talking loud. I mean, he says he can hear, but there's a difference. Yeah.
So what did I just ask everybody to do?
Go. I think I have low frequency stuff, and I've been to an audiologist earlier when I had vertigo, and they did some tests then. I think that, but I'm going to go back and be sure that my hearing is okay because I don't want to miss anything.
Yeah, I hear you, Lillian. Oh, that's great. And John, I'm glad the wax improved it, but it wasn't the full solution.
You need to have them tested.
Oh, that's what I love about this group. We're so honest.
And while we're waiting on the results of the walkers, I know she said stress can have an effect. And I know there's been debate about the alcohol and whether one glass is okay or no glass is okay. But if one glass kind of relieves the stress a little bit, does that help?
If you have to have 3, the stress level is too high.
Yeah, I was gonna say 1 might mean 2, 2 might mean 3.
No, I mean you keep it in moderation, you
Yeah.
know. So
I think staying in that, you know, if it's,
Listen.
yeah, 4 ounces a day, I think you're all right with that. So.
I think sister might want no, and I'm just teasing. I'm about to say, sister, I just need one every day. But I have
Thank you.
first of all, Lisa, if you're ready.
I'm ready. Drum roll.
Drum roll. First of all, we said that this was an honor system. So thank you very much, Miss Friday, for coming in here and saying, wait a second, I did participate and I want my winnings. So I appreciate that, and we're going to keep that on the honor system. But thank you all very much for your dedication, your diligence, for your participation, for y'all. I got a couple of pictures. I got some folks that were inboxing me or emailing me and saying, hey, listen, I might not be on the text thread, but I'm out here. So I just want to thank you so much. As you all know, that walking is really helpful. Towards the end, I sent a couple of scriptures out to keep you motivated and encouraged so that you can actually see with walking towards, walking for the Lord and all the good stuff. And they that walk and don't get faint, all of those scriptures to keep you encouraged, to keep you moving. But I would like to take this opportunity. We did say we had some prizes for you all. I don't know if you knew that the prizes were cold hard cash because you might have walked a little faster or you walked a little further, because we do have cash for our winners of the walk. So firstly, I would like to ask Sister Friday to come up to the microphone, because Sister Friday, you are our #1 walker for the lovely 120-mile walk. You actually did 85, was it, that you just told
No,
us?
75.74.
Well, you did 75.74, but you were the highest in the category. So you beat out our 120. So while you did not make it to 120 miles, I am here to tell you that you did make it as our #1 in our highest walking category. So your prize, believe it or not, is $75. Guess y'all walk next time. I guess y'all won't play next time, won't you? Won't you? Uh-huh.
Are you serious?
I am serious. So I would ask that you text Sister Lisa your phone number, so your address, and give that to me so I can go ahead and get you your gift card mailed out to you. So thank you for your participation. I usually charge for our walks, friends, because at the end of our walks, this is what we do. We celebrate to ensure that you all keep going. But because we wanted this to be a motivating event and get you all excited for walking, period, we're taking care of the prizes. So, Miss Ma'am, thank you for your commitment for walking for Heart Health Month. And you have the highest amount of moolah at $75.
Oh my gosh.
And then moving on down to our 60-mile challenge. Our 60-mile challenge, Sister Stacy Walker has been walking, okay? So Miss Stacy Walker has been walking, and she's our #1. Miss Lisa was stretch goaling it into the 90s, to the 120, but we always say that those of us that are participating cannot win, so she can't win, y'all. So she's not winning. But Stacy Walker did for the 60.
Hey.
Woohoo.
So yes, ma'am. She had 69.09 miles in 21 days. Y'all should be proud of yourself. My challenges are usually 30 days. So you all walk this far in 21 days is to be just it's commended. It's amazing. And then Mr. John came out. When I tell you Mr. John for the third, wait, I guess you say, wait, sister, now how much money do I get? I'm sorry, back up a little bit. Okay, Sister Stacy. Sister Stacy.
Yes, ma'am.
You actually got $50.
Well, thank you very much. I was not expecting it, but thank you very much. I appreciate it.
You are welcome very much. And Sister Stacy, I know you got my email, so you can go ahead on and email me your address. And send that to me. And then now see, I think Mr. John decided he was going to go ahead and walk in the low category because he was just trying to stay down there. He said, I didn't know how he was going to do. But had he been up and he stretched his goal, now he probably would have had it. But see, now, Mr. John, you are the winner of our 30-mile category. But since you did not stretch forth your hands towards the Almighty, no, just kidding. You actually got $25 for winning the 30-mile category. And our 30-mile category, let me see, where did you get down for 30 miles? 30 miles. Mr. John walked 85 miles in the 30-mile category. I know, Miss Lisa, he was trying to play it safe.
Thank you.
You're very welcome. So
John,
we'll get your
John, you should have had a stretch goal. You should have been in the 120. Come on, dude.
I like to sleep in the mornings.
He was walking those 21 days. Then you take a resting.
Listen, he took Sister Lillian with him too for a little bit. Because she had admirable as well. Everybody walked for more than 30 miles. So Sister Lillian walked 55. But I want to let you guys know, I sent a text message to Miss Lisa last evening on our LinkedIn post. And if you will, I would love to just read it to you so that you all can hear what you did and how important it was for what you did. So here is what I posted on LinkedIn about y'all. It says, there's something wonderful about commitment. I always say it wrong. Bahari.
That's
just proved it.
Going.
Exactly. Just proved it in the best way possible. In March, in honor of last month's Heart Health Month, a small but mighty community came together for a 21-day walking challenge, and the results were nothing short of amazing. 447 miles in 21 days. Now we have to add Sister Belinda's on there and really see what that really is, because that number changes. But let's put that into perspective. Prior to having Sister Belinda's numbers for today, that's like walking from New York City to Cleveland, Ohio, or from Washington, D.C. to Charlotte, North Carolina, or nearly 17 marathons back to back, all powered with consistency, community, and heart. What started as a challenge became something bigger, a movement of discipline, encouragement, accountability, and real breakthroughs. Early mornings, isn't that right, Brother John? Late nights, friendly competition, and a whole lot of determination. This wasn't just about hitting 30, 60, or 120 miles. This was about prioritizing health, building habits, and proving that small steps truly lead to big impact. To everyone that showed up, tracked their miles, encouraged others, and kept going, even on the hard days, this is your win. Bahari, you didn't just complete a challenge. You strengthened hearts, built community, and walked your way into something awesome. 447 miles later, and we're just getting started. What a way to believe, move, and grow. Congratulations to every single one of you.
Thank you. And what a way to affect our hearing by improving our hearts through walking. So thank you of what that did. It was beautiful. I thank you, Vakisha, for leading Walking for Talking and the challenge for us in the way that you did generously, and for all of those who promised last month to join and kept that promise. Leslye, thank you for your time today. It was wonderful, and what a nice way to close out March. Everybody have a blessed and a great evening. Thank you for joining.
Thank you.
Thank
All right.
you.
Thank you.
Thank you.
Bye.
Bye.
Lisa,
Yes.
you can get my address either.